insurance.
Okay. Now, early in the book, you raised the question, what is depression? Don't we all pretty much know what depression is, or are you getting at something different?
I think we all kind of understand what depression might feel like. I think some of the confusion or controversy is understanding depression as an illness, as a kind of changes in physiology that affects the brain that can be treated, and drugs are not the only answer.
Yeah. So everybody has periods during which they feel blue. How do we evaluate depression? How do you evaluate depression as an integrative psychiatrist?
It's a great question. I think the difference between the sadness and feeling blue once in a while is different than what sometimes I refer to as almost a numb feeling. It's beyond sadness, and that black hole where there's an indifference to hobbies and projects, changes in appetite, fatigue, sleep, and thoughts of death. It's a very different dimension, and it persists. It persists for weeks and months. So those are the list of symptoms. But as we'll talk about, those symptoms could be due to a thyroid deficiency or a B12 deficiency. And my job has become more like a detective to help sort out what might be some of the underlying contributing factors, and not excluding the psychological and or stress in someone's life.
Yeah, that's what I like about your book and your approach is it is balanced in terms of it's not a black and white thing of it's all nutritional and the brain and so on to the exclusion of psychotherapy. But in fact, it's an integrative approach, right, in which you leave open possibilities for a broader spectrum of interventions.
Right. And that's the frustration I have in the field as people have gone to extremes, either just medications, just psychotherapy, or just vitamins. And it's harder for many of my colleagues to understand we need to use all of our tools to support patients struggling with depression.
Yeah, as a matter of fact, the I think it was the interview just before this one that I did was with a Dr. Peter Kinderman at the University of Liverpool, and I think he's about to become president of the British Psychological Society, and we were discussing the debate about the disease model when it comes to problems in living, if you will, and and so that you would have thought that was resolved some time back, but it's
Right.
still it's still a debate, and it seems to me that you're on neither extreme of that debate, but really trying to kind of play it right in the middle to look at the organic difficulties as well as the purely psychological, psychosocial roots.
Exactly.
Um, Going back to personalized medicine, in that context, you say something about the role of genetics and epigenetics. What can you tell us about that?
Well, I think the longer I practice, it's harder to not appreciate the role that genetics play